So let's talk about some resources you have here as a Sentara nurse. We're going to start with policies and procedures. So this is my main WaveNet page. On the right is resources, and my favorite resource is here under policy and procedure. From here, to see our Sentara specific policy and procedures, I'm going to go to Compliance 360. I'm going to type in blood transfusion, and that's going to get my procedure, so I can tell it's a procedure because of it's saying procedure. Procedures tend to be more step-by-step what to do versus a policy, which tend to be more, this is what the hospital does, kind of more on a legal component. So for nursing, procedures are really, really helpful. So here's my complete how to do a blood transfusion, all the steps. It used to have an Appendix A at the back. It's now been separated out, but it is hyperlinked here. It's its own job aid, and I love this document. So this is one of my favorite documents. We get really good at packed red blood cells. We get then confused if we have to get plasma, platelets, cryo, something like that. This tells you all the different types and how fast to run them and any specific other information. I love this document. So we've gone through Compliance 360. Now we're going to go to Nursing Reference Center. So off of that same policy and procedure link is Nursing Reference Center. If Compliance 360 is Sentara specific, Nursing Reference Center is not as Sentara specific, but is evidence-based practice. So there's not a procedure for inserting an NG tube. There is one on the small bore feeding tubes, but let's do naso. So I've got the inserting and removing. If you have a bunch of random articles and it's like I didn't want articles, I just wanted the skill sheet, moving it to just skills is super helpful. So if I'm going to go here to inserting an NG tube in adults, it's going to give me red flags, tips, pictures of anatomy, possible adapters, looking at criteria. It won't have our Sentara specific supplies, but it's more of a generic best practices for insertion of NG tubes. They usually have really great videos, really great tips. I insert NG tubes so frequently that I used to pull this every time I put in an NG tube, just to make sure I wasn't missing a step. So that's a great resource. They also have patient education here. So if I'm looking for like a low sodium sheet for a patient, I can do it here. One of the things I love about this is you can do cultural competencies and pick them by like ethnic groups. So if you wanted to give culturally sensitive care, this is a great place to do it. And then these just, you open them up and you can print these or just have some more information to give to patients. So that's Nursing Reference Center. Also, we're still in this section that was called Policies and Procedures. So we've done compliance, we've done Nursing Reference Center. We're going to go next to INS. So all of our IV infusions, lines, central lines are based on INS. And so this section, please click here. You actually click on the INS scope and standards. We'll open this up. And this has the baby to teenager one, the acute care one, and the older adult one. So most of the time we're in the acute care unless you're doing peds. And this will open up this document. It's defaulting to where I last was. It does have a table of contents in the beginning. And so if I'm looking for, say, ultrasound-guided long peripheral, and so that's a PIC insertion, then I'm going to go to 85. I'm just going to put the page number in. It usually defaults to you a little bit before, so you kind of have a way to read into it, but it gets you pretty close, all the steps. So we do follow INS guidelines. Next is the Glucomander book. So if you're on a unit that does Glucomander, here's its manual. Super important. Also off of WaveNet are a couple other options here under Learning. So we've been here in Policies and Procedures. We're going to move to the top to Learning. So from Learning, I'm going to start here with the clinical training videos. The clinical training videos are all the ones that we use for Skills and Sim. So some of them will look really familiar. The idea here is just-in-time videos. So if you're doing something and you're like, I don't remember how that goes, I know we saw something, I just want a quick check. including inserting it in GTube. This is a great place for it. Clinical Education and Simulation also has a great website, including RQI, so all your links for RQI and information for that are here. Also talks about basic arrhythmia, charge nurse program, preceptor program, things like that. So all of that is here under Learning, Clinical Education and Simulation. Another thing here under Learning is SCORE. So that's our Centera library, and it is our online search. So say I'm currently writing a paper this week on MRSA. So if I typed in MRSA, of course I'm going to get a million responses, but I love this setup. I can click on online full text. I can click on peer reviewed, and I want something recent. So I want the past 5 years. So this is best practice online. Well, online doesn't matter, but peer reviewed past 5 years are definitely what we're looking for. And then here be your articles. And if I just want to open the PDF, I'm just going to open the PDF. If I want to read the abstract, I'm just going to click on it. So this is a great resource if you're doing an evidence-based practice project, you're working on something for your unit, you're going back to school. SCORE is super helpful. Another thing that WaveNet allows you to do is to search for people to send them a wow. So if I typed in someone's name, I can click here and send them a wow. It just sends an acknowledgement of, hey, you were really helpful to me, and it sends it to their manager as well. Also on WaveNet support services, self-service catalog is how you're going to put in a maintenance request or an IT request or a biomed request. All of those are under self-service catalog. So that's where you're going. The last thing I'm going to show you is in Workday. You're probably pretty good now about how to do modules that people have assigned to you, but you may need to do extra modules that have continuing education credits in Workday. So for that, I'm going to go to Learning, and then go to Discover. So from Discover, I'm going to go to Browse Learning, and say I wanted to work on my pediatric nursing certification. So I can search CPN, and what I need to do, and this is weird, under Topic, I'm going to pick Relias. So from Relias, it's going to open up all the modules that are listed as a CPN, and I'm going to go ahead and enroll in one. So I'm going to click on it, click Select Offering. If I want to know how many CEs it is, I can just click on Additional Course Details. This is going to give me one CEU. I'm going to hit Select Offering. Like it's a real class, but it isn't. This is just how they work. And Submit. And Done. And then when I start course, it's going to actually bring me into Relias. So with Relias, I'm going to have to actually do the module and then come back and do the exam. So when I click on the module, it's going to open it up in another browser tab, and I'm going to go through and do all the information, make sure I've read it all and interacted with all of it that it needs. I do not recommend this just going through. Once I exit, I need to make sure I'm back to this screen and do the exam. So you'll need to do that, the exam, and the evaluation, and then they will show up on your transcript. And your transcript is how you're going to figure out how many CEs you have. So I've got an hour here, an hour and a half here, an hour here, an hour here. So that's how I know how many hours I have currently. So that is Relias. Just make sure that you've done both the module and the test, or it doesn't work. The final thing I'm going to show you is an Epic. So from the Epic button, there are a couple things here I'd like to highlight. One is STARS reporting, so we talk about that. If you have an incident that needs to be reported, STARS is where it's at. And the other one are these CPGs. So these are clinical practice guidelines. It opens it to care plans, which gives you some idea of what to do. But I also like, if you just click on clinical key, there's a bunch of other options here. So it might be evidence-based nursing monographs, drug monographs, care plans, guidelines, labs, videos. So all this is kind of best practice Elsevier content. So all that's available in Epic. The last thing I want to show you is actually from Summary. So I'm in Epic, I'm in Patient Summary, and I'm in Current Orders for Nursing. I'm just trying to keep it clear so that you don't see patient information. From here, you can see any patient who's tele should have this EKG 12 lead, and this is where you would release one if your patient meets the indications heart rate greater than 140 or less than 40, lasting greater than 30 seconds, or persistent chest pain. You would release one and then get that EKG. Making sure that you're aware of when you're supposed to notify the provider. So we've got vital signs and chest pain. And then what I really wanted to highlight was these implement patient safety protocols. So this gives you a lot of our basic nursing protocols, and they're how we are able to put in orders without specific provider orders. Because the provider orders this patient safety protocol, then we are able to do things like consult nutrition or do the nasal swabbing based on their MRSA risk protocol, and do treatment for hypoglycemia. All these are based on these safety protocols. So this is where you go to them. You can open them. So if I wanted to see that hypoglycemic protocol, because I can't keep track of whether it's 70, oh, it's pregnant people, it's less than 60. I can't remember how many crackers they're supposed to get or when I'm supposed to recheck. It's all right there for you just to make your life easier. So all these things are things that you can do based on these protocols. Again, keeping track of the notified doctors, notified tele. It is your responsibility as a nurse to make sure that you are aware of the patient's orders and make it a practice to kind of scan through your orders at the beginning of your shift and keep track of them.